Welcome back to Drugs and Behavior with Dr. Goodin. Now we'll be talking about Chapter 4, the major stimulants, cocaine and amphetamines. Cocaine and amphetamines represent two major classes of psychoactive stimulants, drugs that energize the body and create intense feelings of euphoria. Cocaine is derived from small leaves of the coca shrub, grown primarily in the high-altitude rain forests and fields that run along the slopes of the Peruvian and Bolivian Andes in South America. Okay. With regard to the history of the specific drugs, I will only hit the high points, especially if they affect modern perception. Here's an example of its history and current use that is important to note. 2 million Peruvian men who live in the Indian highlands, representing 90% of the male population in that area, chew coca leaves. This age-old practice produces few instances of toxicity or abuse. I highlight this example to emphasize the use of natural forms of substances, until industrialized and regulated, whether by criminals or the government, is often not a societal issue. Celebrity endorsement was first used to sell a wine-cocaine mixture. This wine-cocaine mixture was sold as an imitation form by a pharmacist in Atlanta, Georgia, who later replaced the alcohol with carbonated water during Prohibition, and this became Coca-Cola. Coca-Cola would later respond to societal negativity towards cocaine and use coca leaves that had been detoxified, replacing the stimulant effect with sugar and caffeine. Freud was known to have used cocaine and given it to his friends and patients. It helped with his depression. He avoided becoming dependent, but one of his friends did become dependent. His friend, Fleischl, used 20 times what Freud had used, inducing a psychosis and experiencing hallucinations of snakes crawling on his skin, a phenomenon called formication. You may want to remember that word, formication. Psychosis and hallucinations of snakes crawling on skin, or bugs and insects. Freud's experience with cocaine is similar to society's experience with cocaine, as I mentioned earlier. The most prominent reaction is a powerful burst of energy. The length of time it takes to affect and its duration depend on how it is taken. For most, it provides a general sense of well-being. For some, it may precipitate a panic attack. As cocaine levels diminish, the mood changes dramatically, inciting irritability, despondency, and depression, uncomfortable enough to produce a craving for another dose. Cocaine is associated with increased sexual arousal and pleasure obtained from sexual practice. It affects the sympathetic branch of the autonomic nervous system. Heart rate and respiration are increased while appetite is diminished. Blood vessels constrict, pupils in the eyes dilate, and blood pressure rises. The powerful sympathetic changes can lead to a cerebral hemorrhage or heart failure. It may damage the heart and many other organs, especially because it inhibits the parasympathetic system while exciting the sympathetic system. Motor skills are adversely affected, so driving becomes reckless. These are acute effects, and we will now focus on chronic effects. Chronic cocaine abusers are often irritable, depressed, and paranoid. Cocaine psychosis refers to hallucinations, together with feelings of anxiety and paranoia. Cocaine users may experience runny noses, bleeding of nasal membranes, lesions on the septum of the nose, and perforations in the nose that affect breathing. Since cocaine has the ability to block the transmission of nerve impulses, it can be used as a topical anesthetic, which means an anesthetic dulling pain for a specific area of the body, such as the nose, tear duct, or throat. An uncle of mine was given cocaine as a topical anesthetic many years ago during a dental visit. Since other anesthetics, such as lidocaine, last longer and have no threat of being absorbed into the bloodstream, they are used instead. Cocaine enhances the activity of dopamine in the brain. It blocks the reuptake process at the synapse, so dopamine stimulates the postsynaptic receptors longer and to a greater degree. Chronic cocaine abuse leads to the loss of about 20% of the dopamine receptors in this region of the brain over time, so pleasure decreases. Let me repeat that. Chronic cocaine abuse leads to the destruction or loss of about 20% of the dopamine receptors in this region of the brain over time, so pleasure decreases forever. Users still crave the drug, but no longer experience the same amount of pleasure. The kindling effect refers to the sensitization of neurons in the limbic system over time caused by cocaine, which can set off brain seizures. And here we see cocaine, as I mentioned earlier, cocaine binding to dopamine receptors in place of actual dopamine. Cocaine use has been a sign of wealth and social accomplishment in the past, and the medical profession remained surprisingly naive about its risks in the 70s. The deaths of celebrities such as John Belushi publicized the negative effects of cocaine and changed public sentiment. The change from coca to cocaine produced 60% purity and later 99% purity in cocaine hydrochloride. Intravenous cocaine can be combined with heroin, and this highly dangerous mixture is called a speedball. It can be administered using a tiny spoonful of cocaine to one nostril or spread out in lines on a polished surface from which it can be snorted through a straw-like object, often a rolled up dollar bill or $100 bill. The change from cocaine to crack was especially damaging. Freebase cocaine was developed by removing the salt form of cocaine in order to obtain a smokable form of cocaine, which can enter the brain more quickly and produce an intense effect. Producing freebase cocaine is extremely hazardous, treating cocaine with highly flammable agents. Crack cocaine is a result of a cheaper and safer chemical method, but also results in a smokable form of cocaine. Treatment with baking soda yields small rocks, which can then be smoked in a small pipe. A cracking noise accompanies the burning, hence the name crack. The purity of cocaine and crack averages about 75% and is more financially feasible at $5 to $10 per dose, making it extremely dangerous for society. It is associated with inner-city crime and violence skyrocketing, mothers neglecting their children, and adverse effects on children of crack-abusing mothers. The stigmatized image of the crackhead has helped decrease the amount of crack usage. 500,000 emergency visits were cocaine-related in 2011, which was 40% of all visits. A cheap form of new cocaine is called Paco and is popular in Argentina and other regions of South America. Coming off of cocaine is very anguished and depressing, commonly feeling like a heart attack. People will do almost anything to keep from crashing on cocaine. Treatment normally begins with an initial phase of detoxification and total abstinence. During the first 1 to 2 days, depression, severe headaches, irritability, and disturbances in sleep are very likely. This may require inpatient treatment in a hospital facility. Although outpatient treatment is less expensive, a person must be very committed and very aware of the negative impact of cocaine dependence on their lives in order to follow through. Note that Robert Downey Jr. has previously spent a year in prison after being convicted on charges of cocaine possession. At one point, he was found with cocaine, heroin, and a pistol in his car. Other celebrities include Drew Barrymore, Samuel Jackson, Michael Douglas, Kelsey Grammer, Eric Clapton, Steven Tyler, and David Bowie. As with most drugs, it is important for those in cocaine recovery to avoid environmental triggers that would help them resume drug-taking behavior. Sometimes both inpatient and outpatient programs are used. There's also Cocaine Anonymous that includes a 12-step program where abusers meet in group sessions, learn from life experiences of other members, and gain a sense of accomplishment from remaining drug-free in an atmosphere of fellowship and mutual support. This is typical of the 12-step programs. Cocaine abuse may also be treated with cognitive behavioral therapy, which will urge the patient to avoid situations that lead to drug use, recognize and change irrational thoughts, manage negative moods, and practice drug refusal skills. A medical treatment can also be used in the form of the compound gamma-vinyl GABA, which is said to short-circuit the reinforcing effect of cocaine by preventing the sudden surge of dopamine in the brain when cocaine is administered. It was developed for the treatment of epilepsy. Relapse remains a significant concern for recovering cocaine abusers. Amphetamines involve a molecular structure with a specific arrangement of carbon, hydrogen, and nitrogen atoms. There are two types, but the main type is dexedrine. A modified form of dexedrine substitutes a methyl group for hydrogen in the chemical structure to produce methamphetamine, allowing for a quicker passage across the blood-brain barrier, and is very popular in modern times. I encourage you to remember and understand the words blood-brain barrier, which has to do with the likelihood of a drug being absorbed into the brain. Methamphetamine is referred to as meth, speed, or crank. The first amphetamines were used by the Chinese as a medicinal herb, used to clear bronchial passageways during asthma and other respiratory distress. German chemists would later isolate the active ingredient, leading toward laboratory synthesis of ephedrine into amphetamine under the brand name benzedrine, used as an appetite suppressant and bronchial dilator. During World War II, both U.S. and German troops were given amphetamines to keep them awake and alert, while Japanese kamikaze pilots were on amphetamines during their suicide missions. As opposed to cocaine, amphetamine was easily absorbed into the nervous system from the GI tract, and its effects were longer lasting. After the war, amphetamines, often referred to as bennies, were already a way for college students to stay awake, to study for exams, and for long-distance truck drivers to fight fatigue on the road. Its euphoria set it up to be used for recreational purposes. It may be noteworthy that pharmacists and pharmacies were easier to trick in the past, and medicines were less controlled. Forged prescriptions or telephoning a pharmacy and posing as a physician were both common. Also note that amphetamine use declined as cocaine got popular in the 70s. It seems that each drug overtakes another drug in popularity and shifts the trend of use. Amphetamines cause increased amounts of dopamine and norepinephrine to be released from synaptic knobs, and also slow down their reuptake from receptor sites. Acute effects of amphetamines resemble the effects of cocaine, and their adverse medical consequences are also similar. However, amphetamine effects extend over a longer period of time, for as long as 8 to 24 hours. Users experience feelings of euphoria and invincibility, decreased appetite, and an extraordinary boosting of alertness and energy. They risk bodily changes that include convulsions, chest pains, and stroke. In 2011, there were over 100,000 emergency visits due to methamphetamine. Heavy methamphetamine abusers may experience formication hallucinations similar to those endured by cocaine abusers. Remember, this is the obsession with the delusion that parasites and insects have lodged in their skin. They attempt to scratch, cut, or burn their skin in an effort to remove them. They often spend entire nights counting cornflakes in a cereal box or focusing intensely on trivial matters. Compulsive jaw movements and teeth grinding can cause significant dental damage over time. Methamphetamine abuse is also accompanied by paranoia and wildly bizarre delusions, hallucinations, tendencies towards violence, and intense mood swings, referred to collectively as amphetamine psychosis. This psychosis may be accompanied by a lack of sleep for 3 to 5 days, resulting in extreme irritability, paranoia, and potentially violent behavior. Symptoms called tweaking. The results are quite similar to paranoid schizophrenia, involving an overstimulation of dopamine-releasing neurons in regions of the brain that control emotional reactivity. Although meth use has been associated with later formation of Parkinson's disease, abstinence from use may help reverse the deleterious effects, which means negative effects. Methamphetamine abuse among the drug community of the late 60s involved speed freaks or meth users who were outcasts of the drug community because they were not peaceful. All classes of society have made use of amphetamines to combat drowsiness or weight control. As cocaine abuse diminished in the 90s, methamphetamine abuse re-emerged on the drug scene. Its distribution was dominated by organized criminal groups operating out of South California and Mexico, extending across the Southwest to the Midwest. Homegrown methamphetamine laboratories have become more common in small towns and rural areas throughout the nation. Toxic residue from methamphetamine manufacture, about 5 pounds of waste for every pound of meth produced, has seeped into the soil and contaminated rivers and streams. There's been danger from inhaling the toxic fumes, from the risks of fire and explosions, and from abuse and neglect by meth-dependent parents. The government has responded by reducing the availability of common products used to manufacture methamphetamine, ammonia, and cold remedies that contain pseudoephedrine. There are limits on how much you can buy, and many over-the-counter drugs have become behind the counter. Methamphetamine has also become a club drug in New York, LA, and other major cities. A smokable form of methamphetamine hydrochloride called ice appeared in Hawaii and has great purity at 98% to 100% and is easily delivered to the lungs. Methamphetamine abusers typically use the drug throughout their waking day at 2 to 4 hour intervals in a pattern that resembles taking medication, while cocaine abusers typically use the drug in the evening and nighttime rather than during the day in a binge-like fashion. This is mostly due to the duration of the effects, wherein methamphetamine effects last longer than cocaine effects. Meth abusers are impaired on tests of perceptual speed or manipulation of information more than cocaine abusers. Methamphetamine withdrawal is similar to the process of cocaine withdrawal. There is a crash involving depression, hunger, agitation, and anxiety within 1 to 4 hours after the drug-taking behavior has stopped. Withdrawal takes between 6 and 18 weeks, during which time the craving for amphetamine slowly subsides. Treatment may be inpatient, outpatient, or through a 12-step program. Few methamphetamine abusers attempt treatment or succeed in recovery, often perceiving control over their own drug use. They have a very high relapse rate. There are approved medical applications for amphetamines and amphetamine-like stimulant drugs in specific circumstances. ADHD is the most common psychological disorder among children at 3 to 10% and is normally treated with amphetamines. ADHD symptoms persist from childhood into adolescence in about 75% of cases and into adulthood in about 50% of cases. As adults, these individuals are 10 times more likely to be diagnosed with antisocial personality disorder, 25 times more likely to have been institutionalized for delinquency, and 9 times more likely to serve a prison sentence. Common medications for ADHD include Ritalin, Adderall, and Vyvanse. Ritalin once dominated the market but had short duration. It was replaced with Adderall, which had a longer duration, avoiding 2 doses during school time, though both have equivalent effectiveness. Many other options have been developed, including time-release and transdermal patches. Stimulant drugs improve behavioral learning ability in 60 to 80% of children who are correctly diagnosed with ADD or ADHD. Stimulant use is associated with stunted growth. To a small extent, childhood and adolescent use of stimulant medication for ADHD is not associated with later substance abuse. In fact, the risk of future abuse is cut in half among these individuals. So how does it work? With ADD and ADHD, there is an issue of sensory overload. Individuals have difficulty attending to important stimuli as opposed to tangential or irrelevant stimuli. The signal, the important part, and the noise, the tangential or unimportant parts, create a signal-to-noise ratio. And it's an issue that can be treated by a stimulant which amplifies the effects of dopamine on environmental stimulation while reducing the background firing rates of neurons. Other effects of stimulants that produce more dopamine in the bloodstream are to heighten one's motivation toward particular tasks. Amphetamines may also be used for narcolepsy. Ritalin has also been crushed up into powder and snorted. In 2006, 9% of students at one university reported using stimulants for non-medical purposes. Another study in 2008 showed that 20% of respondents were using some kind of cognitive enhancement drug, 2/3 of which were Ritalin. This is among a sample of 14,000 students. Ironically, many neuroscience laboratories continuously search for the development of a smart pill. Thank you. I'll see you in Chapter 5.